Hey, Doc, how you doing? My name is Darnell Bennett.
Dan Geynisman.
Good, nice to meet you. Nice to meet you. Thank you for taking time out to talk about this movie that we're doing. It's called The Silent Killer. And it's been very interesting talking to doctors and to find out what is with prostate cancer. As time going on, it's something called advanced prostate. Could you please elaborate and explain that to me?
Sure. Yeah, well, so my name is Dan Geynisman. I'm a medical oncologist. And, in oncology, you have surgeons, you have radiation oncologists, and then you have medical oncologists. And medical oncologists typically focus on systemic therapy. So what does that mean? Drugs, whether that's immunotherapy, targeted therapy, hormone therapy, or chemotherapy. That's our main way of treating cancer, as opposed to surgeons who operate, or radiation oncologists who will try to kind of zap the cancer with their machines. And so for prostate cancer in particular, we are oftentimes involved when the cancer has spread outside the prostate. So remember, prostate cancer starts in the prostate gland, which every man has. And if it's caught early, it can be hopefully cured, either with surgery or radiation. And sometimes we help that. We help with hormone therapy. But if it spreads, if it's caught later on, that's definitely where a medical oncologist comes in to use things like hormone therapy, immunotherapy, chemotherapy, things like that, to stop the growth, get a man into remission, and help him live a long time with a good quality of life. So that's the fundamental role of a medical oncologist. And we sort of collaborate then with surgeons and radiation oncologists as a team. It's really a team approach to treat men with prostate cancer.
Wow, that's pretty amazing. When you talk about the prolong of if they have it a long time and trying to isolate it. What is a lifespan on that?
Yeah. Well, it is highly variable, but men really can live for many years now with prostate cancer, even if you're diagnosed with prostate cancer. Even if we say, listen, we can't cure you, even then, men can live for many, many years with the disease, with oftentimes a good quality of life. So I like to think about it like diabetes or high blood pressure. Mm-hmm. We can't cure diabetes, we can't cure your high blood pressure, but we can give you medications to get under control and for you to have a good life, good quality of life. It's a chronic disease. Mm-hmm. That's ultimately what we try to do with prostate cancer, even if it's advanced. Make it a chronic disease that you can live with, don't need to be ashamed about, can do all the stuff you want to do with your family, but have it under control. And the earlier that you actually come in and have that conversation and begin the treatment, we know you have better outcomes. That's just how it is. The sooner you come in to get treated, the quicker we can stop this progression, the fewer side effects you're probably going to have. And that's really one of the keys is, getting men in to get diagnosed, to get screened, and to get treatment, and at least to have a conversation about it.
Yeah. You talk about men coming in to get treated. We find, I'm 57 years old, we find that it's very hard as men to come in and get treated because of the exam. I mean, that is one of my fears that I have with that. How would you prepare somebody's mind with that as a doctor?
Well, I would say a couple things. First of all, it's true. There's the exam, the rectal exam, and nobody likes to think about that. But we have a blood test called a PSA, which is very sensitive, and that's the first step. That's not an exam, that's a blood draw, number one. Number two, there's actually new guidelines that are pushing men to have MRIs. So pictures, not an exam, to help diagnose prostate cancer. And then of course there's a biopsy involved, but the exam is actually slowly starting to fall out of favor because it's actually not that sensitive. We're not that good actually at detecting prostate cancer with the exam. If you don't have anything else, it's the best you've gotten. That's fine. And so historically people do it. But I would tell a man that, listen, if you're worried about an exam, why don't you come in first and have a conversation, because you might be surprised about what the doctor will tell you. They may tell you, let's get a PSA test. If that's elevated, maybe we need to get an MRI. If there's concern there, we can talk about a biopsy. Maybe you'll need an exam, maybe not, but at least have the conversation. And I think if most men at least have a conversation, hear what an exam is like and how quick it is, and even if it's necessary, I think most men would be okay. And if they're really not, I think most doctors can find a way around it.
Got you. That's really interesting, because I know that would be one of my fears that I have.
Yeah.
The question I have for you is, when we look at this and we talk about this, why does it affect the African American community so heavily and so much?
Right. Yeah, that's an important, good question. So African American men are almost 2 times as likely to get diagnosed with prostate cancer, and about as high of a rate of dying of prostate cancer. And I think there's a couple of reasons here. A big one I would kind of put under the bucket of social determinants of health. It's access to healthcare. It's coming in and seeing docs. It's sort of socioeconomic factors. It's where you live. Some of it perhaps is biology. It's the genes you're born with that are slightly different, that may predispose you to higher risk, more aggressive prostate cancer. But I'll say one of the interesting things we've found in the recent years is if you take an African American man and you take a white man and you treat them the same way, you give them the same advanced care, they actually do just as well. In fact, some studies show that African American men do actually better and respond better to the drugs than white men. So I think a big part of why the rate of diagnosis is higher and certainly the mortality is higher is worse access to care and just not the same degree of care. I think if you take you and I, and we both walk into the office of one of the urologists or radiation oncologists here, and we begin our journey with prostate cancer, I think we would have fairly similar outcomes if you take 100 guys like us, as long as we have access to that care.
Wow, that's really interesting, Doc. Sitting here, you thinking that because it's in the African American community, but when you just broke that statistic down, that's really interesting for me to know that. When I'm looking at this, or when the world and society is looking at this as it's being explained, what can we do to promote this, or how can we? I want to say, we look at celebrities, we go to the barbershop, we talk about basketball, we talk about this, we talk about that. How can we promote this, or, get the word out about this test?
Well, I think you just have to be honest about it. Every man has a prostate. It's the most common cancer of men. And as we get older, as men get older, changes happen to the prostate gland, and many of us will develop prostate cancer. It's just a fact. It's just a fact of life.
It's a matter of time, you would say?
It's a matter of time. So it's a normal course of life, and let's talk about it. Let's talk about what we do, just like we talk about other things that we may not want to talk about, other chronic conditions we don't want to talk about, okay? Because there's a lot that can be done. See, I think 10 years ago, 20 years ago, if you don't have a lot of things you can do, you'd rather not talk about it, because what's the point of talking about it? There's nothing you can do. Well, now there's a lot that we can do. So it's normal. Probably if you're sitting in that room, if you're sitting in that barbershop and you talk and you look around, there's going to be a whole bunch of other people that have this cancer or will have that cancer or had a brother or a father with that cancer. So it's not a rare thing at all. So let's just have that conversation. And I think it's that first step, just get in the door once and talk to somebody about it, talk to a physician about it. I think my experience is if men do that, most of that fear, that anxiety about it goes away, and you're able to get good care, and you're able to kind of enter into it. So I think it's just saying, let's talk about it, let's get that screening done. Right. There's nothing to be afraid of.
Yeah, because most men are married and their wives bring them in. I'm quite sure you see it in the office that most of the wives walk right in the office with them. My last question would be to you, what kind of advice could you give about the silent killer?
Yeah, I think it's silent if you don't talk about it, and I think if you sort of pull back the curtains and just discuss it and shine some light on it, it's not going to be a silent killer because there's a lot that we can do about it. So, I mean, it's akin to, you brought up women, you brought up, breast cancer, and mammograms. Who wants to go in and get a mammogram? But women do that all the time, and it saves lives. And I think there's no reason the men can't do the same thing.
So you're trying to say we go in, come in a little bit more. Hey, that's what I feel.
Yeah.
Well, listen, Doc, I appreciate you for spending some time. I know you have a very busy schedule, and I think you and I'm quite sure that we can get to people out there in the world and more men, because this thing is really serious. This silent killer is really serious, and I really appreciate it. And I'm quite sure that we probably touched some person out there or some man out there that is facing this challenge. Because me at 57 years old, I know you already don't face me because I am going to be setting up my exam. So I really appreciate you.